Wrap it up, 5 seconds more. Quickly put your answers in. All right. So 70% of you are correct. Woo! Not good thing. Not good as 2.2 billion, but okay. Next one, 3. Is plastic recycling rate over 30%? Now this is for globally. Is it true or false? Only 2 options. There should be quick. Two more seconds. False. Unfortunately, it is not over 30%. Okay, let's go question 4. So which country has the highest renewable energy usage? We got Iceland, the US, China, or Germany. All right, start to wrap it up. And 5 more seconds. All right. Okay, we're gonna show the answer. It is Iceland. Oh! Nice, woo, good job guys. Okay, so next one. What percentage of global population lacks basic healthcare services? We got 45%, 43%, 50%, or 37%. Okay, we're gonna give 5 more seconds. All right. Answer is, oh! Whoa, okay. Correct answer is 50%. Okay, next one. What percentage of people lack access to, wait, did we do that? Oh wait, what percentage? Sorry. Not number, percentage. So 10%, 30%, 40%, or 20%. Okay, I'm gonna wrap it up. Answer is 40%. Okay, let's see. Question 7. What percent of children lack access to education? 20%, 10%, 37%, or 27%? All right, give you 5 more seconds. All right. Answer is 20%. So it's a good thing it's not 37%. Okay, let's see. 81% of you chose 37%. Okay, let's do number 8. In 2020, there were around 27.8 billion illiterate youth in the world. True or false? I'll give you 10 more seconds. All right. Answer is false. Now let's see. So according to UNESCO 2023 report, 99 million illiterate youth globally, that's based on 2020 statistics. There are 36 million located in Central and Southern Asia, 49 million in Sub-Saharan Africa, and 56% of them were female. Okay, let's do question 9. What is solid rain? Is it small-sized hail and NGO that provides ice to villages, a form of irrigation, or slang used in the 70s for frozen well water? Okay, I'm gonna give it 10 more seconds. Let's try to make 42 at least. Okay, let's see the results. It is a form of irrigation. Right? You thought solid rain is ice? No. So what is this? Now this is a non-toxic biodegradable powder polymer developed in Mexico. It can absorb 200 times its weight in water, and is spread under crops to store rainwater up to 6 weeks. And it's placed in the root area to help make it remain humid, and it saves Mexican farmers 80% in cost. Now this is less water, fertilizer, electricity, and labor. And this is also a solution to the drought problem there. Okay, question 10. Global malaria cases are starting to decrease each year. True or false? All right, 5 more seconds. All right, so let's see what the answer is. It is false. So let's see why. So you would think that because we have more health education and treatment, that we would lower the cases of malaria. However, due to global warming, there's a surge of mosquitoes. So that's also why we have a surge of malaria. So according to WHO 2023 report, 2019 we had like around 233,000. 2022 we increased all the way to 249,000. So let's do last question, final one. Let's make this quick. Number of refugees in 2022. Do we have 20.8 million, 34.6 million, 28.0 million, or 32.7 million? I'm gonna give you guys 10 seconds for this one. Okay, 2 more seconds. Okay, let's check the results. 34.6 million. Okay, let's see. So in 2022, refugee numbers hit a record high of 34.6 million. Now, it's according to UN in 2023, and 40% of them were children. So what you saw just now is an example of what we're going to be discussing today, what this class is about. So hopefully, did you guys have fun with the test? Yeah? Okay. So we learned about a lot of global issues, right? We learn about at school, online, friends or family, or even out in public when you're just walking around. Now, not so often do we learn about the connections between them. For a lot of it, we may not know that the condition of one global issue can lead to the improvement or the worsening of another. So the other thing is that we hold the power to make changes. Now we're discussing about global issues, but we as youth also hold that same power to create these changes as any adults in the world. So raise your hand if you heard about SDGs, like Sustainable Development Goals. Okay, that's good. So for those of you who may not know, SDGs are 17 goals the United Nations and hundreds of countries around the world are aiming to hit by 2030. And now this is all to establish and create a more sustainable world for everyone to live in peace and in prosperity. So there are 17 goals. Unfortunately, we don't have enough time to go 17 goals. So we have 3 that we're going to focus on. One is climate action, which is something we discuss a lot. Second one is zero hunger, leading to good health and well-being. So starting with climate change, again, it's something we learn a lot in class, right? It's probably, out of all global issues, if you're in science class or English class, it's something that is always brought up as a major issue. You may have heard of Save the Turtles movement, or learned about the Great Pacific Garbage Patch, which, by the way, now has increased. It now covers a surface area of 1.6 million square kilometer, and into perspective, it's around double the size of Texas. Now, raise your hand, have you heard of Bill Nye? Good, they still show him. Okay, so for those who may not know, Bill Nye is a former mechanical engineer, a current TV presenter, but he was best known as a science educator as the host of the series Bill Nye the Science Guy. So since this is a topic that we discuss a lot in class or outside, we're actually going to have Bill Nye review with us what is the causes and the impacts of climate change.
We hear it so much that it feels like a buzzword, but it is far from it. Climate change is a real and serious issue. But isn't the climate always changing? What exactly is climate change, and why should we care? Well, the Earth's climate has changed throughout history. Most of these slight changes are caused by small variations in the Earth's orbit. But climate change as we know it today is characterized by an abrupt increase in the Earth's temperature. It is estimated to have gotten 1.2 to 1.4 degrees Fahrenheit warmer in just the last century. 10 out of the last 13 years were the warmest on record. 97% of climate scientists agree that this new tendency is not caused by the variations of the Earth's orbit, but rather very likely caused by human activities. That means you and me. And since the Industrial Revolution, we have come a long way. Humans built airplanes, faster cars, developed remarkable technology, and learned how the natural resources around us can be used for our benefit. Although this has led to many wonderful inventions and advancements, like the device you're using to watch this video, or the ability to take a plane halfway around the world, it also means we've increased our consumption of natural resources and in turn released a lot of greenhouse gases into the atmosphere. Now, greenhouse gases occur naturally, but in excess can be dangerous to our planet. Modern human activities have increased the release of non-naturally occurring greenhouse gases because we have stepped up our demand for burning fossil fuels. The composition of greenhouse gases traps heat radiated from the sun. The more heat they trap, the warmer our planet gets. And as our planet gets warmer, we begin to feel the effects. One of climate change's biggest victims is our oceans. Oceans regulate the Earth's temperature and provide 50% of the Earth's oxygen. Now, climate change has increased the global temperature of the oceans by more than 0.3 degrees Fahrenheit since 1969. Although a warmer ocean might seem inviting to a beachgoer, it actually has devastating consequences for supporting life at sea. One of those consequences is ocean acidification, a direct effect of increased dissolved CO2. Since the late 18th century, ocean surface acidification has increased by 30%. A higher acid content means calcifying species, like oysters and clams and shallow water corals, are at risk, putting the entire ocean food web at risk. This is bad news for the 1 billion people relying on the ocean as its primary source of protein. Climate change has also caused the sea level to rise. Just in the last century, sea levels have risen 6.7 inches, but the rate in the last decade has nearly doubled. Sea levels have risen because as the ocean gets warmer, it swells. On top of that, glaciers and ice sheets are melting. Antarctica lost 36 cubic miles of ice between 2002 and 2005, and since 1994, each year on average, the Earth has lost 400 billion tons from its glaciers. That's like an ice cube 7.5 kilometers on a side, 4 miles on a side, melting and flowing into the sea. When all that ice melts, it fills up our oceans, and just like filling up a bathtub, the shores can't hold all that water, and coastal regions get flooded. Troubling signs of climate change are increased extreme weather events. Natural disasters like floods, tornadoes, and deadly heat waves are more obvious to humans because of their immediate impact and their sharing of the images in the media. Climate change, as we know it today, is change in our Earth's overall temperature with massive and permanent ramifications. Although its consequences can be planet-threatening, scientists still believe there are things we can do on a personal level to help. Recycle and reuse things. Walk or use public transportation to get to work. Turn off your electronics when you're not using them. Eat less meat. While you're at it, eat more locally grown vegetables and foods. And last but not least, spread your knowledge and concerns about climate change with others. When it comes to climate change, the main takeaway is that it's real. And although we are part of the cause, we can also be part of the solution.
Like Bill Nye said, climate change has increased temperatures, right? But also increased the severity of extreme weather. And it's been causing impact on, for example, our oceans and ecosystems. So let's see about other effects of climate change. One is food security and supply. So changes in temperatures, rainfall, and frost-free days can lead to longer growing seasons. And this is across a lot of states in the US right now. But longer growing seasons has its positives and negatives. Starting with the positives, it means we could plant longer maturing crops or more crop cycles altogether. Negatives is that we have to have irrigation for a longer season that is throughout hotter weather. Now, it also happens to be that when plants absorb more ground level ozone, it can lead to decreased levels in photosynthesis, slower growth, as well as higher sensitivity to disease. It also means a combination of warmer temperatures, changes in precipitation, can affect when flowers bloom or when pollinators come out. And when they're mismatched, not as much pollination will occur. Now, in case you guys didn't know, Africa experiences most frequent and severe storms. Now, they have experienced the fastest rising average temperatures compared to the rest of the world. For example, 30% increase in rain in wetter regions, 20% increase in rain in dry regions, and 95% of African farmers, they rely on rainwater because there is no irrigation system set up yet. Now, the thing is, agriculture productivity decreased by 34% because of these impacts of climate change. Now, extreme weather also is one of the drivers of world hunger. Like I said earlier, it has caused an increased number of droughts, floods, cyclones, hurricanes, as well as heat waves. So based on 2023 census report, 2.5 million were forced out of their homes just because of extreme weather. And based on the data from the past decade, globally, 23 million people were displaced from their home each year. So without dramatic change to mitigate this climate change, it's expected that by 2050, 200 million people will need humanitarian aid annually due to the effects of global warming. So raise your hand if you have noticed the temperatures getting hotter each year, especially during summer. We've experienced heat waves, especially this summer, right? A lot of them. So because of heat waves, they're dangerous and keep getting an increasing number, especially for people who may not live in homes where they get AC, good ventilation. This could lead to health problems. Now, many tropical and subtropical climate populations are chronically exposed to high temperatures. And like I said earlier, they are all part of the population that may not have AC or have good ventilation. So in addition to humidity, the indoors can feel hotter than the outdoors. So let's observe and kind of analyze the increase in temperature and education. So more than 40 million students in 2024 alone, in the first 6 months, were shut out of classrooms due to heat waves. Now we have a quote from Hannah Khan, who is a ninth grader student in Bangladesh, who said, "There is no real education in this punishing heat. Teachers can't teach, students can't concentrate, and rather, our lives are at risk." So let's look at some statistics. South Sudan closed schools to around 2.2 million students in late March, and that's due to temperatures reaching to 113 degrees Fahrenheit. How many of you have experienced that? 113? A couple of us, right? Central Valley? Yeah. So we have also Philippines and India. Thousands of schools closed classrooms to over 10 million students in April. And did you know, especially in these type of countries, many of these classrooms don't have good ventilation, AC, or let alone a fan. And if they do, it's just one in the corner of a classroom packed with 70 students. Now with infrastructure with no good ventilation, good insulation, that doesn't help their case either. Now let's look at impact. Cambodia ordered all public schools to end 2 hours earlier just so their students can skip that peak heat. Bangladesh contemplated opening and closing schools for around 33 million students due to students preparing for their exams. So climate change impact on education is closer to home than we may think. So in case you guys didn't know, some of our schools in the northern part of the US don't have AC. Now it's because they were older buildings, and back then the temperatures weren't that bad. They didn't need AC, but now they do. And for those older types of schools, they may not have the budget to renovate and get these type of ACs or even a fan going on. So there's also another concern, is the increasing gap in education in developing countries and developed countries. And this is because studies have found that high temperatures slow down the brain's cognitive function, which then lowers the ability to retain and process information. So if we look at a 2018 Harvard study, they observed 44 university students. Some of these students lived in dorms with AC, and some of these students didn't have AC. So they were studying in these type of conditions. They found out that students without AC had 13.4% longer reaction time compared to those who studied in the AC room, and scored 13.3% lower. So a solution is we can return to online learning. How many of you guys liked online learning? That's what I thought. Oh, Vincent, you did? Okay, that's okay. But there's a problem with that also, right? The concern is for the poorer countries and low-income families. So in countries like the Philippines, where they are vulnerable to climate change, and they are still recovering from the longest COVID-19 closures. So the problem is that the educational gap between impoverished children and those in urban areas continue to widen compared to those in rural areas who are unable to attend schools. So even for here, right, we have 2 students, they're sharing 1 phone. The thing is, they're 2 different grades. So lack of rain and extreme heat kills livestock as well as damages crops, but so does too much rain. So for example, Pakistan, August 2022, catastrophic monsoon floods. 33 million people were affected. South Sudan 2022 marked their 4th consecutive year for flooding. Nigeria 2021, they had a delay in rainfall, which resulted to a reduced harvest by over 65%. But when they did get rain, it wiped out the rest of their crops. So NASA also made some predictions. So they think that the US sea levels will rise by 1 to 6.6 feet by 2100. Now this is due to melting land ice. Hurricanes will also become stronger and more intense as temperatures increase. And before 2050, the Arctic Ocean is expected to be ice-free. Now there are solutions. Some countries have implemented, as well as individuals have implemented. So if we look at Singapore, they have included or incorporated plant life into their structures, whether that's in their own homes, companies, or even public buildings. We have the jewel from their Changi Airport, a park where these weird-looking trees are actually air filters, but also give them a place to have more plant life. The thing is, having more plant life can reduce the temperature in the surrounding area. So for example, you stand in a parking lot compared to a park where there's a lot of trees, even though it's the same temperature, same day, same time. You'll feel cooler when you're standing under a tree in a park where there may be grass. So another country is Copenhagen, right? So they have something called bike highways, which makes it more accessible to ride their bikes, get one place to place safer. They don't have to worry about too much riding the bike along the street next to the buses as they're zooming past. Or they even have houses, like the A house, where it is built solely for them to be able to ride their bikes all the way up to their front doors, their apartment doors. Now, TCYA also has their 5 R's. We have refuse, reduce, reuse, recycle, and repurpose. Now, a common thing that we all know is our recycling program. Now, these recycled bottles or PET materials that we gather is used to create TCYA products or Great Love products. Now, we have our TCYA uniform, which some people here may be wearing the white pants from. We have jackets, shoes, and many more. We even have creating wood tiles or bricks that we can use when we're building homes or schools. Now, of course, we have our eco blanket when we provide them to those impacted by disasters. In addition to our multi-purpose 定式 beds and the chairs, as well as the new partitions. So now that we just talked about climate change, let's kind of shift a little bit to hunger, malnutrition, and food waste. Because like I said earlier, they're connected, right? But before we do that, by show of hands, how many think number 1 is experiencing malnutrition? Okay. How about 2? 3? 4? How about all 4? Okay, it is actually all 4. First one is obesity, second one is severe acute malnutrition, third is stunting, last one is micronutrition deficiency. So to understand why these 4 are experiencing malnutrition, we have to understand the definition of them. So hunger, short-term physical discomfort as a result of chronic food shortage. In severe cases, it's due to life-threatening lack of food. Malnutrition is a longer period of time compared to hunger, and is due to excess, deficiencies, or imbalance in nutrition or energy intake, which is why all 4 of them are experiencing malnutrition. Now, this can lead to severe health issues, and this is often categorized between undernutrition or overnutrition. Now, famine is when a population is experiencing widespread malnutrition and hunger-related deaths due to the lack of access to food. Now, the United Nations has specified that in a specific geographic area, in order to be considered in famine, must meet these 3 criteria. First one is 20% of the population is suffering from extreme food shortage. We have 30% of children under the age of 5 are suffering acute malnutrition, and the death rate of an area has doubled. Or 2 people out of every 10,000 people die each day, or instead of 2 people, is 4 children. Now, poverty is a principle for a lot of global issues. So like those global issues, it's the same case for hunger. So this could be the lack of resources, unequal income, as well as conflict or hunger itself. Now, there's also 3 leading causes of hunger. We have political instability, food and agriculture policy, and climate change. So what are the impacts of world hunger? 1 is issues in cognitive development, therefore resulting in poor academic performance. Lowering productivity by increasing sickness, which is because they get sick so often, they have to pour more money into their healthcare needs. Now, for health, it also leads them to be more susceptible to disease because of weakened immune system, but also that means they slow down their physical growth. So let's look at the current state of food insecurity and nutrition in the world. 2023, 8.9% to 9.1% of the global population were undernourished. So it seems like a small number, right? It's less than 10. But if we look into perspective, that's 713 to 757 million people who are undernourished. So that means from 2019 to 2023, we had a rough increase of 152 million people facing hunger. So let's look at population and perspective again. Africa is 298.4 million. Asia is 384.5 million. And then Latin America and Caribbean is 41 million. Oceania is 3.3 million. Projections by UN by 2030, they think that 582 million people will be chronically undernourished, and 53% of the global population facing hunger is concentrated in Africa. 2023, it was found that 28.9% of global population, which is about 2.33 billion people, are moderately or severely food insecure. Now, how many of you know what it means to be what food insecurity means? Okay. Food insecurity is when you run out of food at times during the year or go an entire day or more without eating. Now, food security, on the other hand, is having physical, economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and healthy life. Now, there are 4 pillars to food security. You have availability, access, utilization, and stability. That means having enough food and meeting their dietary needs. Access is being affordable. Can they purchase it? Utilization, do they know how to use this produce to create delicious food, or are they just gonna not know how to handle that part? Stability is stable access over time without sudden disruptions. Now this means any kind of disasters like earthquakes, tornadoes, and such. So a major contribution to global food security is food waste. So by show of hands, how many have you or yourself or seen someone in high school not finish their meal and have to scrape it into the trash can? Right? So the schools provide us with healthy options, but because some of us may not like those options, we don't eat it. But in that case, we can't even say, hey, can I just not take this, and because I'm not going to eat it. The thing is, the school can't do that because they are to require healthy options, a balanced option. So it leaves a lot of food to be thrown in the trash. So let's look at some statistics again. So 1.3 billion food per year is left uneaten globally. And recent UN reports makes it seem to be unlikely to reduce global food waste by 50% by 2030. So how much food is wasted on a global scale? Does it impact food security? And what can we do as individuals or as a community? So let's watch a quick video.
Worldwide, 30% of food is lost or wasted. This averages out to 614 kilocalories per person every single day, about the same as 10 medium eggs or 21 large carrots. But wait, what does this have to do with climate change? When food is lost or wasted, all of the resources that went into making it are wasted too. Globally, this accounts for 1.4 billion hectares of wasted land and 250 kilometers cubed of wasted water every year. That's a land area larger than Canada and India put together, and enough water to fill up 100 million Olympic-sized swimming pools. What's more, food loss and waste are responsible for 8 to 10% of global greenhouse gas emissions. These emissions not only come from the production and transportation of the wasted food, but they also come directly from the rotting food itself when it is broken down by microorganisms. Despite all this waste, in 2019, nearly 1 in 10 people around the world were exposed to severe food insecurity. Reducing food loss and waste by just 50% would provide enough food to feed all of these people and then some. Although food losses occur at all stages of the food supply chain, their main cause varies between different countries. In wealthier countries, more than 40% of food loss and waste occur at the retail and consumer stage, largely due to consumer behavior and food supply exceeding demand. Food losses in lower-income countries mostly occur earlier in the supply chain, due to poor harvesting techniques, insufficient storage and cooling facilities, and a lack of infrastructure for food transport and marketing. So, what can we do to reduce all of this food loss and waste? Well, let's begin at the start of the supply chain. We need to reduce food losses on the farm itself. Suboptimal conditions, such as not enough water and too much heat, significantly reduce the growth potential of food crops. And 20 to 40% of crops globally are lost to insect pests, weeds, and diseases. Global soil quality is also degrading, making it harder for plants to access the nutrients they need to grow, and forcing farmers to rely on artificial fertilizers. By improving soil quality and exploiting natural interactions between plants, animals, and their environment, farmers can improve crop yields whilst reducing waste and resource use. Providing farmers with effective harvesting technologies will also be important, as food is often lost to damage or spillage during the harvesting process. One of the biggest causes of food loss in lower-income countries is storage. If food is left somewhere that is too hot or too damp, it can easily spoil or rot. Improving storage facilities and transport infrastructure can therefore significantly reduce losses. If lower income countries had the same access to refrigeration as richer nations, food losses would be reduced by 25%. To solve this problem, we need to develop low-cost, off-grid solutions for food preservation, such as mobile, solar-powered storage. Food processing and more durable packaging can also prevent food spoilage during storage, transport, and at the consumer stage. Although we would need to consider the sustainability of the packaging that is used. Even so,
Okay, so due to the time, we'll cut the video short. But that also gives you a little more information because next class will actually be where you'll use this type of information to help you in developing your next activity. Just kind of keep it secret still. But to sum up what the video is going to talk about, food is wasted and lost at several stages throughout the whole process. From the time it's harvested, to the manufacturing, producing, all the way to our kitchens and to our tables. Now, there are many ways we can do our part as an individual or as a collective global community. So what are some things that we can do or have done? We have imperfect food shapes. So why is that a concern? One, a lot of us are used to buying or seeing perfect shaped fruits. And this has led us to see that those ugly or weird shaded produce is inedible, unsuitable, or just gone bad. Now, because of this, the farmers know that people may not buy these type of produce. So instead of wasting money transporting all this produce to another location, they rather just let it rot and be wasted. So instead, we have companies like Imperfect Foods and Misfit Markets that work with others in the agricultural business to collect these imperfect shaped fruits to either give to local food shelters or even selling it to the general community who's willing to buy these type of produce. We also have companies like Hello, I'm Ugly, who turn weird shaped fruits to dried fruits. So you don't see the weird shaped fruits, but at the same time, they're still edible. They're perfectly good. Another way is as youth, right? We have some people who are interested in AI, for example, like Neil. As a teen, he developed a passion in AI, saw a problem in India when he was visiting his grandpa, and saw that farmers in resource-scarce areas may not have access to resources or knowledge on how to identify diseases in plants, how to take care of it, and what are some solutions. So again, due to time, we won't be able to see the video, but hopefully this kind of gives you an idea of how youth can be part of the results or the solution.
Inspired by a visit to a farm in India.
So another way youth has helped is, for example, Katie's crop. So as a kid, as a part of her elementary school project, she started to grow cabbage. She saw that she developed this passion for gardening, so she started an organization. She built an organization to teach them how to cultivate, how to do gardening in general, right? And her organization has now grown to a community center where others in the community can come and learn with their children, their family, and all the produce grown here is donated to local food banks. We also have, for example, in Fresno County, we have a community garden, which is something found out recently. So they have plots of land that they rent out to low-income families nearby for a very cheap rent. And then volunteers will go and share with them how to cultivate produce and hopefully give them access to healthier food options. Especially with inflation, produce cost is getting higher and higher, but we still want them to be healthy. We also have some communities who have something called community fridge, where either restaurants may have leftovers that are still perfectly good, or other neighbors may put more food inside the fridge for others who may not have access to them that day. Now, access to healthcare and health education. So this one's kind of a more complex situation. So I'll actually let the video run this time.
What if your drive to the doctor was over 2 hours and the wait was half as long? Would making an appointment be at the top of your to-do list? Suppose you were diagnosed with a chronic condition, but couldn't understand the directions on your prescribed medication. These are some of the challenges surrounding access to healthcare. Access to healthcare refers to the ease that people get the health services they need when they need it. It's associated with multiple social, economic, and environmental circumstances, including gender, income, education, geography, and cultural factors. Take geography, for example. About 20% of the US population live in rural communities. yet less than 10% of physicians practice in these areas. In the UP's Ontonagon County, a rural county of roughly 6,300 residents, there are only 2 mental health providers. Lack of insurance or inadequate coverage is also a significant barrier to accessing healthcare. In 2014, Michigan launched the Healthy Michigan Plan, the state's expanded Medicaid program, which offers a range of health benefits at a low cost. So far, the plan has helped over 700,000 members see a primary care doctor. The bottom line is that timely and affordable healthcare access impacts physical, social, and mental health. And while increasing access is a complex challenge, we know that patient outcomes and life expectancy can be greatly improved by reducing everyday barriers to care.
So like the video says, there are many barriers that reduces one's access to healthcare services. And like how we took the quiz earlier, a lot of people lack access to basic healthcare services. So it could be gender, race, ethnicity, lack of healthcare professionals, poverty. Even if you have insurance, some people still have reduced access to them because of the coverage. Now, if we look at maternal mortality, not a lot of us look into these type of statistics when we look at healthcare access. But this is actually part of the SDG goal, to have 70 deaths per 100,000 live births by 2030. And in 2020, 13 countries reached 500 to 999 out of 1,000, which is really high. Because that means a lot of them are dying when they're giving birth. Now in total though, we do have 117 who have lower or very low of these percentages. So for example, only 100 deaths or below 60 deaths per 100,000 live births. Now, because these type of disparities may be as a result out of subnational regions or their place of residence, meaning that their home may be far away from a healthcare facility. Now, it could also be their socioeconomic status, their ethnicity, their inconvenient transport, like I said earlier, or lack of medical facilities. So the image right there is actually a Tzuti facility in Malaysia, and it's located in Pita Mountain, Malaysia. And the thing is, this facility was created due to concern for the high infant mortality rate among Aboriginals, because their homes up in the mountains is quite far from the closest hospital. So this area is to give the mothers a safe place to rest, to be healthy, but also to give birth, which they have successfully given over 1,800 births. So health risk and climate change affects people differently. Now there's also people with higher risk. We have those living in poverty, elderly, women, children, indigenous people, outdoor workers, those who are socially isolated, but as well those with pre-existing conditions. So to kind of an overall wrap of the statistics, is around 2 billion people have no access to clean water. 600 million cases globally are foodborne issues, and 40% of those are children, which has led to over 125,000 deaths each year. Now, extreme weather and climate change stressors can lead to degradation of water, soil safety, as well as an increased risk to waterborne and foodborne illnesses. Now, seeing a doctor is not always a priority, which is unfortunate for many people. So this, again, there's a lot of barriers, right? Language barriers, stigma, or even, like I said earlier, limited resources. So let's set a scenario, migrant worker. Migrant worker is uninsured, low income, a husband, father of 5, and his mother lives with him. For him, seeing a healthcare doctor is not a priority for him. He'd rather go work, get the money, and support his family. So how many of you heard of Tzuti TCYA mobiles? By show of hands. Good. So to show kind of what it is, I'll use the example of Fresno. So in Fresno, we have multiple Tzuti mobiles, and it's like vision and dental. So the purpose of this is to bring much needed healthcare services to those who are underserved, right? So we have a program called Our Migrant Family. We're providing medical, dental, and vision to migrant workers in rural areas. Now our slogan for this is, if you can't come to us, we will come to you. We understand that there are barriers. We also want you to know, and we want you to take care of your health before it's too late. Now, the reason why I had a scenario of the migrant worker is because that's actually a case that happened with us. We had an event where we had it specifically for migrant workers, and we realized one of our patients who came in for appointment didn't show up, but his wife and his mother did. We found out that he decided to stay late instead and not coming here and decided to work instead. We followed up with the family later on, found out he actually died of a heart attack, which unfortunately could have been prevented if he had come to us. So increasing accessibility to healthcare services is to also make sure that more people can take care of their health and make it their priority. So if you look at the US alone, right, due to transportation issues, 3.6 million people do not receive medical care. And 1 million children miss their medical appointment. Other countries may have universal healthcare resources and coverage, and however, resource-scarce countries and community regions may rely on, like for example, TCYA provides free healthcare clinics, or maybe there's healthcare centers that provide free resources, but other places rely on community health workers. Now, we won't be able to see the video, but I'll kind of give you a summary. Essentially, let's say a village, and one person within the village volunteers to take classes to be certified to be a healthcare worker. They are in association to a clinic who may be far away, but the clinic will send one person each month to follow up to make sure all these patients are well taken care of. So that means while a nurse or a doctor may not be on site, they have a neighbor who will take care of them and make sure that their health is okay. So while I won't share the video, I will, 1 second.
In Africa, there are millions of people who live out of the reach of healthcare. 1 out of 5 children will not reach the age of 5. They will die from malaria, pneumonia, conditions we know how to treat.
It does not have to be that way.
The traditional model for healthcare is people go to the facility to seek help. With the community health model, we take the services to the people.
A community health worker is a trusted neighbor.
They go door to door and provide services that prevent illness.
It is cheap, and yet the impact is immense.
Right now, governments are rewriting their plans for their healthcare systems. The question is, will we do it right?
What it will take is investing in the last mile, ensuring that every child and family has a community health worker in their neighborhood or in their village.
Are we going to do what's needed to support these community health workers? Will we be as brave as they are every day in how we design the systems to support them?
Roslyn, hi.
So like I said in the beginning, healthcare is a very complex issue. It's a big project. And it requires work as a community for the health of our community. And the thing is, it's like any other global issue, right? We can't work alone. We have to work as a community. So for healthcare specifically, we're not just about increasing accessibility to healthcare services, but also working on prevention. So one of that is health education, just providing knowledge, providing the tools and resources, and giving the power to them to take care of their health as well as taking care of the health of others. Now, one of them is non-communicable diseases, which is NCD short, and CDC has determined that it's a leading cause of deaths as well as a global threat. It has accounted for 41 million people, the deaths of 41 million people each year, which accounts for 74% of global deaths. And 86% of these premature deaths occur in low to middle income countries. So again, this is according to WHO. And part of it is the lack of knowledge, the lack of education for example, let's say diabetes, right? Leading back to our migrant family program, a lot of our patients did not know they had diabetes. And then that's a problem because that can lead to various issues, blindness, or leading to hypertension later on. So, not to make this a downer, this is a very sad class, but there are many problems around the world. That's unfortunate. But the thing is, there's also many solutions, and we just haven't found some of them yet. So why should we be involved? We're just a bunch of high schoolers, college students, we're youth. Why should we care? Because as you can see from these 3 issues, they're connected, whether that's global warming, to food supply insecurity, to access to healthcare because not a good diet. These global issues have an effect on each other and therefore will loop back to affect all of us. It may not happen in your community, but if you think about it, we're one global community. Like TCYA, we're one global family. So what can we do? It's not just about learning about these issues, it's about taking action. It's like our slogan, lead with courage and serve with compassion. So it's following up with action. So ways to do this, like I said earlier, global issues, it's a big thing. It's daunting, it's a lot of things to do, and we're just youth. But it's not impossible to do. There are a lot of NGOs out there that are led by youth and have been successful in helping many communities in their own local area or in other countries around the world. So some tips that we can share with you is don't be afraid to fail. There's always going to be problems coming up, and that's okay. We work together as a group to problem solve, to overcome these challenges, and move forward with the same mission to achieve that collective goal and harness each other's strengths. We all have different strengths as well as weaknesses, so we kind of help each other to kind of help each other, I guess. So one is collaborate. You can find each other, make connections. So for example, here at the retreat, you can meet many people from different regions. You also have your Discord channel where you can access or connect with others people after the retreat. You also, like I said earlier, persevere, but believe. Dharma Master Singh always says, believe that you can, and then you can do it. So thank you for your attention. I know it's really long with a lot of statistics, but like I said earlier, a lot of these statistics or information is to lead you into the next activity, which is our service hackathon. So we hope that you look forward to a lot of fun activities. This is more of an informative session, but our activities and classes later on will be more hands-on. So we're actually going to go, I'm going to pass it on to Brianna to make some announcements. Thank you.
All right.